Good evening. I'm Arlene O'Reilly, host of tonight's Spotlight Nantucket Q&A. This program has been funded by the Community Foundation of Nantucket's Nantucket Fund for Emergency Relief. With me today, I have Jerico Mele, the Town of Nantucket's Human Services Director, Roberto Santamaría, Town of Nantucket's Health Director, and Gary Shaw, Nantucket Cottage Hospital's President and CEO. Thank you, gentlemen, for meeting with me today to clarify some information that is important for our community and the island workforce to really gain some clarity at this time as COVID variants continue to batter our community. Here's the first question, and we have a list of questions from varied community members that sent this to us ahead of time. So question one, what do we do when we're exposed to someone who tested positive?
I'll take that one. So what we've run into is there has been some confusion as it really goes along, but the recommendation you use when you've been exposed but don't have the illness and you're watching to make sure the illness is there. Then there's isolation, which you do after you have been confirmed having the illness. Go and get yourself tested to make sure you have or do not have the illness. If you wait if you do 4 or 5 days, your likelihood of having a true positive or the true negative increases with every more day you wait. Definitely, if you show symptoms of any kind, headache, fever, malaise, things like that, lack of smell, please go in immediately to get yourself tested, especially if you know you've had an exposure.
Okay, so just to replay that back to you, if I don't feel any symptoms, I could wait 5 days to see if it kicks in. However, if I'm feeling some symptoms, isolate for 3 days and go in and get the test. It sounded like that's what you were saying. Was it good?
Correct. You should always isolate if you know you've had an exposure.
Okay.
And it's also important to note that the periods at which, like the 3 to 5 days after, is when the viral load is high enough to be detected by the test, but it's also the start of your infectious period. So if you are going to get a test, or if you are waiting to hear results back, that's the time you need to stay in your house the most, is while you're waiting for your test results.
No, I didn't know that. So you're the most contagious in the initial number of days that you might have gotten COVID. Okay, that's good to know. That's why it's so important to isolate.
And there's obviously significantly larger amounts of context to it than that. But the easy rule of thumb is that often the tests are looking for the same thing that is going to be transmitted to other people to get them infected. So that when you are testing, that's also, the tests are looking for the same thing that is being passed on to other individuals. That's a fair simplification, but it's a good rule of thumb in terms of trying to figure out whether you can go someplace, what you can do, that sort of thing.
Okay.
Arlene, I would just like to add that really the gold thumb on testing is a PCR test, a nasal swab that actually finds the virus, the actual virus. And on our website, you'll see that we have 5 days there. And, in testing, it's, the most accurate level of development of symptoms is probably going to be in a 3 to 5 day period. We say 5, so that you have the highest chance of having the most reliable outcome, to see that there's enough virus that's been produced. And so that's 5 days that we're recommending, but that's to find an actual virus particle. And then we know that you can take the appropriate steps to get better.
Okay. Thank you, Gary. Well, that leads me to the next question. So when one needs to isolate and cannot self-isolate at home, for example, single parents or crowded housing, what can we offer our viewers as far as best advice for that?
Well, Roberto, I think we're probably going to flip-flop back and forth on some of these, so I can take the heat off of you. But we've always talked about being able to separate yourself in bedrooms if possible. Wearing masks at home is probably a necessity if you're in a high-density environment. Washing your hands and socially distancing. Outside of going to a different location where you have less density, which isn't really appropriate or even capable for a lot of people. So that's probably the best option you have. Once you've known that you're positive and tested, to be able to go home and wear a mask and try to stay in that mask, as much as possible. How would you add to that, Roberto?
I think you're in good shape. I couldn't say it better. Recommend anything?
The only thing I have to add is that there are systems in place to assist people for quarantining and isolating. We have the Family Resource Center, which can then direct people onto a variety of different resources around housing, rental assistance, food, and connecting people to medical resources. If you're interested in any of that, you can find it all on the town's COVID resource pages. And you can also call me, and I'll try and get you connected.
Well, that's good to know. So like I was actually thinking about those single parents, that might have, a 12-year-old or 10-year-old or whatever. And, what do they do? And I was thinking you're probably going to say that they have to wear a mask around that kid if they know they've tested positive, and that's the very least. Maybe double mask, I don't know, but it's good to know that the town has resources there set up. That's good.
To be fair, the town is really only in an advisory position in that. A variety of human services providers and a lot of volunteers and a lot of very motivated people sort of stepped up, and I was lucky enough to come along for the ride on that.
Yeah. Okay. Next question. What are the proper protocols for management of any business or organization when a staff person tests positive? And what should management do when the staff person is not feeling well and they haven't tested positive? This is really more for the businesses.
Absolutely, that one's really difficult to answer because it depends on the nature of the business, really. So what we've been running into is that if the protocol involves a person who is living in a dormitory, for example, you need to set up that dormitory area. You have to move out those who are sharing a room and isolate and quarantine that person so that you can isolate the person who has tested positive. That person, we highly recommend that you go to the CDC's website and get the guidance for communal living, because that gives you the whole protocol on what to do within a dormitory setting. But in a nutshell, that person needs to isolate. They need to if they can, not share a bathroom. But in the situation that they can't, every time they go in, they should be alone, and they should definitely clean it out or sanitize the area after their use, and try to isolate as much as possible in the room. We do understand that food can be an issue and things like that. So using the kitchen, if you're there by yourself, or have somebody, if possible, have somebody prepare the food for you, and then get that over to your location. As far as work goes, those of you who have worked together, those who work with a positive, they should already be informed. The manager should inform those who have worked together. We are also doing contact tracing as well, and you may expect a phone call from CTC, which is the Contact Tracing Collaborative from the state. We were recently issued a grant. We found out yesterday at the end of the day that the state Department of Public Health has given Martha's Vineyard and Nantucket a joint grant to fund some contact tracing as well. So over the next few months, we'll be looking into, not just looking into, but implementing another method of contact tracing. If you receive a phone call for contact tracing, please pay attention to what they're trying to tell you. Same process as 2 questions ago. Quarantine, wait to 5 days, get tested, and then see where we go from there. See if you're negative, you should be in good shape. You should still monitor your symptoms for another 5 days. If you come back positive, you should isolate yourself for the 10 days immediately after, regardless of vaccination status. Let me see what else. They should, what we have been seeing is that some businesses have been shutting down 48 hours or so. 48 hours is not necessary. What you should do is just close enough until you can sanitize the area in which the person that was there. We know that fomites are the way that you, if the virus is on the table or something, we consider that a fomite. We know that is the least infectious method. So sanitizing isn't as big as a deep clean as we used to believe it had to be. A simple wipe down with quaternary ammonium or a bleach solution is more than enough. And then if you have the staff, that has not had to quarantine, you can reopen at that point. If you do not have enough staff to reopen, that's a management decision, and you can choose to reopen yourself.
Okay.
Is anything, Jericho, Gary?
There are on occasion some really weird edge cases that make applying protocols on a general basis difficult to do. If you have something weird happen, call me. That's what I do. I get back to people as quick as I can, and we'll do a timeline and figure out exactly what the right set of circumstances is.
Okay. That's good. So I guess then this, I don't know if you guys can answer this question, because it sounds like you're saying it's really depending on the type of business and the manager's discretion, of course. But the next question is, should managers and staff be made aware of staff members or relatives of staff who have autoimmune disease? And can you explain why those with autoimmune disease or immune compromised are at a higher risk even when vaccinated?
That's definitely difficult to answer as well, because we cannot force anyone to divulge personal health information. A person who has an autoimmune disorder, they have to be willing to disclose that information. Otherwise, it is between a physician and the patient, whether they want to disclose any sort of autoimmune disorder. So it is management or staff should not require the disclosure of that information, but if a person is willing to disclose that, then that is totally fine, and then they can respond. Those who are having some sort of an immune compromise, they are at higher risk, even when they are vaccinated, because of that lack of immune response.
Yeah.
So they should definitely do the 3 to 5 days of wait and get yourself tested if you've been exposed.
And I guess those with those conditions are in a very tough position. And I think it's, I can't even imagine. So, all right, next question. If let's say a staff member isn't feeling well, like they kind of have like allergy symptoms, but it keeps recurring over and over again. Do you think they should be tested for COVID? And is it okay for them to head to work while they're planning to go get tested for COVID if they have allergy-like symptoms?
Well, I would say that any symptoms that you have that make it different from the way you felt the day before would merit probably getting tested, especially when you're in a high environment with the surge that we've had with COVID prevalence. You just don't know because the virus is so infectious. And if there's ever a question, you could always call the Cottage Hospital and ask, based on your medical history and get some guidance that way. But a symptom is a symptom these days, and unfortunately, there are a lot of colds going around in addition to COVID. So the only way you're going to know is if you have a symptom that's not the same as what you had the day before. You should be tested, in my estimation, so that we can know that you have the greatest opportunity to learn if you're positive, and then put protective measures in place to keep you and yourself, others around you safe. So it's just a moment to be careful and think it through. My grandkids came to visit in 2 different weeks, and I ended up with 2 different colds, and I went and got COVID tested on two different occasions. And of course, I was fortunate to be negative, but you just don't know, what's in the air, what you've inhaled, and what's in your body. So best to exercise caution is my advice.
Okay, that's sound advice. When one is getting a negative rapid test, but yet they feel sick for over a week, what should they do? And that meaning that it's a negative rapid test. I think I know the answer to this, but it's a question that came in.
If they have a negative rapid test, but they still feel sick, definitely make an appointment and get yourself PCR confirmed. The rapid tests, though they have a really strong, what's called specificity or sensitivity, they're really good at finding the true negatives. If you are still showing symptoms, there is a possibility that was a false negative due to user error, especially with the rapid tests. So go in and get yourself PCR tested to confirm.
Okay.
And additionally, even if you did everything right with the take-home test, if you caught it too early before it had time to incubate fully, it might not show up in quantities sufficient to be tested.
Okay. If one person in a household gets a breakthrough infection, should everyone get tested in the household?
Well, I think the guidance is that yes, that's changed from what we had in the past. But I just want to remind people too, when we have breakthrough infection, that the vaccines are still doing what we know they're designed to do. They're still protecting from serious illness, but it does mean that you're still infectious and you need to isolate yourself and protect yourself from others during the communicability phase of that. So to know the exposure in the household. I believe the current recommendation is that you should come in and get tested as well, so we know the scope and the extent if it needs to be isolated.
Okay. Anyone else on that one? Actually, Gary, this is a good follow-up question to what you just said. What are the symptoms of a breakthrough, in COVID infections? So, can you speak to that at all?
Sure, it's a great question. A very, 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 very small proportion of individuals that have come to the Cottage Hospital with breakthrough have had significant symptoms. And we've only had a couple of instances where those became severe and people needed to be given some supplemental treatment or even taken off the island, but they were very immunocompromised due to conditions in their health that didn't allow them to generate a good immune response from the vaccine. But we know that that's a very, very small proportion, and so that's good that a majority of people are protected. There are people that have come in to the emergency room for something else, a laceration or a toe cut, and just through questions that the staff asked, they ended up being COVID tested and they were positive and they didn't even know it. So we're finding those. But I would say that the majority of folks that we're seeing come in that are a breakthrough are mildly ill, have an upper respiratory infection of some sort, just feel junky, just like I've got a mild version of the flu, and I want to know, is this COVID or is this something else? And so I think that's where we're seeing most of the symptoms land, rather than those that don't know anything about it, or those that are really severely ill.
And that can be the very frustrating part, I think, is the masking of it to, whether it's allergies or just a head cold versus COVID.
Right. It's a frustrating part,
yeah.
But the goodness in this is that we know that you probably won't produce a severe illness or progress to that. And we know that you know how to then go home and isolate so that you can protect others that you don't want to give this to. So the vaccines are doing their job. We would have hoped that vaccines would have sterilized the virus and it would have just never produced. But now we know that a breakthrough is possible, but you're very, very unlikely to be severely ill. But people do come in with questions, and we encourage they do and be tested with any symptom that they've got that's not what they had the day before.
And that's a perfect segue to the next. It's a question, but it's really more of a statement. Some people might be asking, what's the point of getting vaccinated if breakthrough infections still happen? And I've actually heard people say that myself. So maybe we could just drive that home a little.
Well, I'm sure Roberto and I could pass the message, but I actually think that if you're one of those individuals that have, for whatever reason, decided you don't want the vaccine, my advice to you is, actually, I could share with you firsthand knowledge of many, many, many people that have been infected, and what they'll beg you to consider is, don't let this happen to you, because it's completely preventable. And it is nothing you want to experience, nothing you ever want to go through. It's horrible, and it can kill you, and it's preventable. So I would run to get a vaccine and get yourself safe. if nothing else, protect the ones around you, protect the ones that you love. This is not a political illness. This is a true infection, comes from a viral particle that wants nothing less to infect and spread, and it's killed a good percentage of its hosts, and that's the reality of what we know. And then it has a propensity to take out healthcare systems, overwhelm nursing homes, take out the ones you love. So the more we can do to vaccinate and eliminate the spread and the ability for this to replicate into more even severe types of illness, we should be doing that. I think we owe each other that responsibility and, quite frankly, love of our community and love of our families. So run together.
That's really well said, Gary. Thank you. Roberto, you have anything to add there? I can see you smiling, so.
So really what it comes down to, Gary really hit it. And it's worth saying again that the virus doesn't care about your political thought process. This virus has been politicized way too much. What it really comes down to is that when it came down and hit us in 2020, we had 100% of our population was susceptible to this virus. Right now, with the vaccines, we're close to, nationwide, close to about 50% of the population vaccinated, which means 50% of the population is still susceptible to the virus. And when you think about it, you hear a lot about how, well, only about 10% get hospitalized. And let's say because of vaccinations and things like that and interrupted chains of transmission, we'll say something really nice like 5% get hospitalized. Well, in a population of, we'll say, 100,000 people, 5% is 5,000 people. So now you know how many systems do you know have 5,000 ICU beds available? Right. And of those 5,000 ICU beds, we'll say another 10% need ventilators. That's 50 people. So those are 50 ventilators that we're going to be that this hospital system is going to be needing. That's on top of heart attacks, car accidents, strokes, surgeries, whole 9 yards. So the quicker we can get the population vaccinated, the quicker we can start opening up the capacities of these hospitals. The sooner that the vaccination gets approved for children, the quicker we can get mask mandates slowed down, the quicker we can start interrupting the chain of transmission, and the less variants you see. So that's perhaps the biggest portion. If every eligible adult who have received Moderna, Johnson & Johnson, or the Pfizer vaccines, we wouldn't have to vaccinate the children because we would already be at herd immunity. But because people are refusing to get it, those who are eligible, we now have to rely on vaccine mandates. Mm-hmm. So if you voluntarily get yourself vaccinated, you're not necessarily just helping yourself, you're helping your entire community. Let's get through this all together.
That was beautifully said as well. Gosh, you and Gary, Roberto. Oof. How about you, Jerico? You have anything to add?
So let's see if I can follow that one. It's worth noting how much worse the outcomes are for the unvaccinated. Basically, you have to look at the UK and Israel as a preview as to what's going to happen nationally for the US. And 2/3 of the under 50s who have died from COVID have happened post-Delta, and they were unvaccinated. The health outcome differences between the vaccinated and the unvaccinated could not be more stark. And even if it doesn't kill you, COVID can put you in the hospital to the tune of hundreds of thousands of dollars of debt. There's a ton of reasons to avoid getting this vaccine, to avoid getting the virus by getting the vaccine. And they cover basically all of the reasons why you would want to protect it from a disease. You're not going to pass it. You're much less likely to pass it on to people who do not have the same health that you do. You are much more likely to lose money, to lose time, to lose behavioral health stability. You can have your entire life kicked out from underneath you. And the only thing that you would need to do to avoid that is get a free drug once or twice. I cannot stress how much more important, how much, basically it's a life preserver in a sinking ship, and people are trying to argue themselves out of taking it. And I do not understand why people have done that. But, Delta is a very different disease in terms of how it passes on and its health outcomes amongst the unvaccinated. And so it's very important for everyone to be vaccinated as soon as they possibly can.
So Arlene, I just want to add there's a tremendous amount of energy on this also from the healthcare provider side when providers are seeing people coming in and these are folks that have taken a lifetime of training and put compassion into how they deliver care, who are really frustrated with the communities that don't vaccinate and then come in for this care that's totally preventable. And so a large portion of a healthcare administrator's job now is to try to convince my staff to stay in healthcare after this last horrible 18 months. And very, very quickly across the country, we're seeing providers, nurses of all levels just get out of healthcare because they can't do it anymore. They're just burned out. And it's because there's this big divide related to vaccine, not vaccine, and it all lands in a provider's lap when they're seeing somebody on a ventilator literally suffocating to death at all different age levels, and they know it's preventable, and they just can't take it anymore. So help the providers cope. They're your line of life-saving resources, and it's slowly going away because people are moving out of the profession, and healthcare entities are finding it more and more difficult to staff all sorts of care, curtailing some services and surgery and other things to be able to staff areas that they can't hire people for anymore. And that's the reality of what's occurring as an industry change related to how this infection is impacting populations that refuse to get vaccinated.
Yeah. Like I read on the news over the weekend that a doctor down south had refused to treat patients that weren't vaccinated if they were coming in for COVID, which I thought was an interesting posture for him to take. So, but I'm just going to give us a time check. We're just there. We have a couple of minutes left, so I'm going to just leave us with one question. Last night on the CDC had added 6 more destinations to very high COVID-19 travel risk list, including the Bahamas, and they are recommending not to travel there unless you are vaccinated. Many of these destinations, as I looked at it, were islands just like Nantucket. And I'm curious, where does Nantucket stand with COVID cases? I'm sort of aware of it, but are we high or are we very high? And do you have any forecast as to where you think we're going to go with this? Like, do you think we might go back to limiting numbers of people again, and then we'll have to close on that note?
So it's very important to understand that with the relic of epidemiology that we're seeing is I would say even a few cases here and there on a daily basis would be considered something to worry about. But we at the same time have to start understanding that COVID is here to stay. And shutting down things, limiting indoor gatherings, things like that, we're just going to prolong the inevitable, which means that over the course of the future, the reason we call fall and winter cold and flu season is because of what happened 100 years ago with the flu pandemic.
Right.
In 18. We're now probably going to be calling it COVID and flu season moving forward, because COVID is something that's going to continue to be endemic in the populations of the world. However, with that being said, most of the areas like Nantucket are islands. Most of the high-risk areas are islands because there is a general overall sense of freedom is a way to say it. So a lot of these places are vacation destinations. That's why they're on the travel lists. So when people are showing up, we've all been cooped up for 18 months. We all have that energy. We all feel like we need to let loose a little bit. But by letting your guard down, you are increasing the risk. We all still have to maintain our own vigilance and maintain that responsibility. Nantucket, probably between medium and high, I would say. And Jerico, Gary, correct me if I'm wrong in any of that. Medium and high. But what we really need to start seeing and really see is that we need to learn to live with the idea of the virus being out here. With flu, what we see is a seasonality of it. When we're in flu season, the World Health Organization is watching what predominant level strains of flu are happening. They develop a vaccine for that predominant level and deploy it in the southern hemisphere before the flu season starts there. And then while the summer season is in their flu season, we monitor them to see what vaccines are needed for the upcoming flu season in the northern hemisphere. That's all we're going to be seeing with COVID, this flip-flopping of every year, a new strain of vaccine is going to be needed, and we're just going to need seasonal vaccines.
Okay.
It's the reality of where we're
That's the reality. And then, Roberto, I'll just say there was one question that came in as you were talking, and this will be the last question. The trades don't have to wear masks while they're working indoors? Question mark.
If you're indoors, you should be wearing a mask. Period.
Okay. So someone was saying that somebody had said that the trades don't have to wear masks indoors.
No, if you are indoors, you need to be wearing a mask. Period. Not a question.
Period. Okay, thank you for clarifying that, because that was a quick question.
Yeah, if you're inside and it's not your house, basically you should be wearing a mask.
Mm-hmm. Okay. And that's it. I think we have to, I think they're going to put the cane out on my head here and pull me off to the side. So, gentlemen, thank you so much for talking with us. There were more questions that we did not get through. And I thank the community for sending all these questions into us, and maybe we could, meet again in another month or two, depending on how things are going, to help keep everybody clear on the steps that they need to be taking. So thank you again, and have a good evening, everyone.